If you got knee osteoarthritis, you know how frustrating it can be. It's one of those things where it can feel good for years, and other times it can feel like it's the beginning of the end. But what if I told you that there's a more hopeful story to this? It's a story where you understand your knee, and you change your relationship with pain, and even change your relationship with your brain.
I bet you heard phrases exactly like this, maybe from a doctor, maybe a well-meaning friend, saying it's bone on bone, or that it's just wearing out. And it's so discouraging. And it paints this picture that everything's just going to go downhill from here, and that you're fragile. But what if that whole story is just wrong? Or at least not the whole truth? Look, the reality is that we might not be able to reverse every little thing inside the joint, but your pain, your ability to do things, your quality of life can actually get better. It all starts with changing the story we tell ourselves. Okay, let's talk about something that's really important that actually might surprise you. Whatever your doctor sees on your x-ray or ultrasound is not your destiny. It is not the final word of how you feel or what you can do, not even close. So first, what is osteoarthritis? Well, in its core, it's just a label for some common changes that happen inside your joint. A better way to think about it is like getting wrinkles or gray hair. It's part of life for many of us. And just like having gray hair doesn't automatically mean you're frail, these joint changes don't automatically mean you're destined for a life of pain. And this right here is where the science gets fascinating. The common belief is simple. The worse the x-rays look, the more pain you have. But the research says that the link is surprisingly weak. I mean, there are tons of people out there with x-rays that looks like a total disaster zone who have zero pain. But on the flip side, with people with really mild changes can have a lot of discomfort. So the picture is not the whole story. So if the x-ray isn't telling us everything, then what is? Well, it turns out it's a mix of different things. And that is important to remember. You can actually influence things like how strong your muscles are, how much you can move every day, and even stuff like stress levels and sleep. All of that can literally turn the volume dial on your pain levels up or down. The most important point I want you to take away from this is that you are not broken. Yes, your pain is 100% real, absolutely, but it is not the true reflection of damage, and for sure does not define your destiny. So my wife is a clinical psychologist, and we talk about our patients a lot, especially when it comes to the mind and the body. See, pain isn't just a signal coming from your knee. It's being created, interpreted, and controlled by your brain, which is kind of like a super sophisticated alarm system. Scientists call this the predictive model. So basically your brain's number one job is to protect you. And it does that by constantly trying to predict something like movement. Is it safe or is it dangerous? Now, if your brain has been hearing for years that your knee is wearing out, it might get a little jumpy, or at least you might predict that things are a bit dangerous, and it becomes overly sensitive. It's kind of like a sensitive car alarm, sending out big and loud pain signals, even for movements that are quite safe. But here's the most powerful piece of the puzzle. That alarm system, it's not stuck in that way. It can be retrained. You literally teach your brain to dial down the sensitivity and relearn movement is safe, that it's good, and that it could even feel great again. Okay, so you're probably asking, how do I do that? Well, it's actually quite simple. We do it in 3 parts. It starts with education, exactly what you're doing right now, trying to understand how pain really works. Then you add in some smart, safe strength training. And finally, you use the new strength to slowly, gradually, and little by little, do a bit more over time. Each step proves to your brain that it's okay, that the movement is safe, and that it can turn that alarm system down. All right, so we covered the why. Let's talk about the real keys to taking back control and the things you can start focusing on like today. First thing, and the most important thing, is building strong muscles. Think of an army of muscles like your quads, your glutes, and your calves protecting your knee like it's its personal bodyguard. They're the shock absorbers and they provide support so they can take the pressure off the joint. It's simple. Strong muscles means a happier, more protected, stable knee. Next, it's all about improving your body's tolerance for activity. So what is our capacity? Now, this is not just gritting your teeth down and pushing through with pain. No, it's about being smart, being consistent, and showing your body little by little that it can handle more. Over time, what used to feel really hard becomes manageable, and what was manageable starts to feel actually quite easy. That's adaptation, and that's what we're shooting for. And really, that is the ultimate goal, isn't it? To be able to move with confidence instead of fear. When you start to understand your pain differently and begin to trust in the strength you're building, you can finally let go of the hesitation that's been holding you back for so long. It's changing the relationship of your pain and understanding what your body can and can't do. how long you could do things, and what makes things angry and what makes things easier. And the results of the recipe? It's a knee and a body that's stronger and more resilient, and just way more reliable. And the best news of all, the path forward isn't a big complicated secret. The recipe is actually quite simple. Get in consistent strength work every week, follow a gradual walking plan, and keep feeding your brain with the kind of confidence building education you're getting right now. This isn't about some magic pill. It's about building a better and more capable body. I absolutely love this quote because it just nails it. A diagnosis, sure, that's just one chapter. It's part of your story for sure, but it does not write the ending. So you see, when you put all these pieces together, you're not just managing your knee osteoarthritis. You're actively consciously writing a brand new, way more empowering story for yourself.